Jana, you were mentioning there about some of the psychological complications and how this can affect you as powerfully as the physical complications in some instances at some times. So what was your experience of the emotional impact of this?
Initially I look back and I know I was angry. I didn't think I was at the time, but I was very angry, and it manifested itself in great bouts of crying, great bouts of shouting, rows with my husband, unprecedented rows. He, of course, couldn't handle it either, so we were clashing very, very badly, and this was very serious. He, one day we went somewhere and he left me standing there, drove off in the car. I came back. We had awful rows about that. And that was horrid when you're feeling ill, and also you're having rows of an unprecedented nature. So I think that was anger within me, and he didn't know how to cope. We didn't know where to go, we didn't know what to do, and we were bumbling along really. And then, as I said, after I'd finished the chemotherapy, and everything had been sort of on a roller coaster up to then, from the February 11 to the September, to be just roller coaster, treatment after treatment after treatment. No, just have the chemotherapy for a week, get better for 2 weeks. I was going into work for 2 weeks. I was fine. Fortunately, I had no sickness. I would say do take the antiemetics. They're marvellous. So I didn't have any sickness, but so tired in the week. And then it was a run up to Christmas, and our son's birthday is also near Christmas, so I have a lot to do. And I just started bursting into tears, and I was emotionally unstable, I think. And I was low, very, very low. I would say depressed looking back. But I still didn't think about going to the GP or anybody or doing anything very much. And I felt out of the system. I felt abandoned. I felt lost. I felt I'd been dropped.
Is that because the intensity of the input had reduced?
Yes, because I was seeing nobody. I had no consultant appointments. I was seeing nobody. I had an appointment booked, an operation booked for January, February, and that was it. And there was nobody else in touch with me, and I just felt lost in the system. I just thought, well, nobody is looking after me now, and it became very obvious to myself that I was on my own. I do have a supportive network, but the nursing and the medical care wasn't there, and I felt lost, totally lost. So I then went in for my operation, and I think I saw somebody from the psycho-oncology team came to see me in hospital, and at the time, just a couple of days after my operation, she said hi, and I didn't need it. I didn't need psychological help at that time. My concern was to get well physically. After I sort of got well physically, and in fact I was doing okay, and then I returned to work. Well, we are undergoing some management changes at work, and the abolishment of my department and displacement of staff. I was there for 2 days, an awful 2 days, and I had to go to bed at the weekend, and I stayed in bed all weekend, and I was crying. And then I rang in for help to the psycho-oncology service because I was in pieces, and this cancer, the combination of not knowing what my health would be like, the uncertainty about my health, uncertainty at work, culminated in me breaking down, I think. And I was very, very vulnerable, and I didn't realise I was so vulnerable. But I was a classic wreck. I mean, I couldn't speak. I was shouting down the phone to people. I didn't know what to do. I mean, my lowest ebb the previous year was when I phoned the Samaritans at 3 o'clock in the morning because I didn't know what to do.
And one of the issues there is that people don't always ask for help in that situation.
No.
And another is, even if they want to, it's not always clear where they should go.
No, I think for me, I felt this has been a journey that I have had to direct and seek out the help that I've needed, especially on the psychological front. I mean, I suddenly discovered Helen Webb House as a charity help centre in Leicester that deals with people with cancer. I don't know how I discovered it now, but I think I was doing a little searching online. But not one of the professionals had referred me to that.
No.
I don't know why, but I found them, and that's helped tremendously. I've been helped tremendously with counselling, and also knowing what to say to people. Is when people say, "How are you? You look well." Knowing how do you cope with that, but I think I've got a lot better with being able to cope with things, and things seem to happen this year as well. When I was in this depressed state, my mother-in-law died, our dog that we'd had for 11 years died, our son came back from university, so there was changes in the household, and the work was changing, and everything in my life seemed to come in on me.
Certainly when somebody's depressed, the challenges that they would normally deal with seem more severe.
Yes.
Sometimes impossible to deal with.
Absolutely, yes. You cannot see, you can't see any brightness anywhere. My mother used to say, well, Janet, it's sunny outside. And I said, Mum, it doesn't matter if it's blazing at 80 degrees. It really doesn't matter. You can't enjoy it. I can't enjoy it. But I have to say that I think it's like bereavement. I mean, I think you cry every day, and then all of a sudden you're not crying every day. You're just crying when there's a trigger. And I have to say, I went on to antidepressants. I was very reluctant because I thought I'd become addicted. I have not. My GP said, look, they're low level, they will help you, lift you. And what I've discovered being on antidepressants is they don't mask your moods. I thought they would, but I still cry, I still shout, and I still laugh. So if somebody suggests to you take antidepressants with some counselling as well, it's a good option. It's like a safety net, and I look at it as if you had a big gash on your leg, you wouldn't walk around with it expecting to heal. You would put something over it, and that's how I've had to look at having psycho-oncology counselling, because those are big words and they're frightening words, and you think I'm going mad, but actually talking about yourself for an hour is a complete luxury, and it's great. And I think that's benefited me immeasurably.
Now, sometimes people are offered psychological one-to-one sessions.
Yeah.
Sometimes antidepressants. But you also came across Helen Webb House, which tends to perhaps give group support sometimes, or peer support from other patients can be valuable.
Yeah.
Sometimes there's information out there that's useful.
Yeah.
Are there any other of those additional resources?
Yeah, there's the peer support. It depends where you are in your journey. I didn't want any peer support early on. This is my second year. I'm in the second year of diagnosis. So, or since my diagnosis, I'm now able to talk to other people with problems. I didn't want to talk to anybody else with problems last year. Too raw, too sensitive to myself. But now I can talk to others, and we can share experience. You can share experiences on things like, are you taking any supplements? Are you drinking any nice juices? Where did you get that bra? What you can get a benefit for this, or you can get a benefit for that. And just share that. And also, when you go to a group support meeting, or they're not called groups, when you go to a meeting, you don't have to pretend. Everybody knows you've got cancer. So you don't have to, if you get upset, it doesn't matter. You don't have to put a front on. And I think, when you're going to work, or sometimes with your family members, you put a mask on. But there you can, when I first went, I couldn't be bothered to get dressed up very well. And I think that happens for a lot of people. You just go in your old pull-on joggers, and you don't care what you look like. Really, you're just glad to get there. But eventually you come round. And we also did lovely sessions of craft, making things, which I found great, because I didn't think I was artistic. But we've had a really lovely leader called Sam Court, who I will give a plug to, because she's a great artist. And she just inspired us all to make silly pictures and do mood boards, and there's something about concentrating on a little piece of art, little bit of craft, and losing yourself because you're not thinking about anything else. And that's what I love about that as well. I loved doing that, and subsequently I've done some at home.
It's a certain form of distraction, but one that leads to something positive, a creative hobby, which is very positive.
And I think the other thing is that I've learnt from all this is that I had, like a lot of people, I had a lot of responsibilities and a lot of things to do, a lot of people in my life. And I used to feel quite guilty about spending time for myself, giving myself or letting myself do something for a couple of hours without thinking, I must go round to mum and dad's, must feed the dog, must do this shopping, must do this cooking, must sort James out, must ring so-and-so. No, because when you're ill, when you're lying in bed for 6 weeks, the world stops and you stop with it. And so if you are stopped in your tracks, as you are with cancer, enjoy it really. Enjoy the freedom to just do nothing.
Well, once you're better, it can help you reprioritise what's important.
Yes, and that's true. But I don't feel guilty now about having the odd hour making a card or in fact going to Helen Webb House. I've been going now for about 6 months. And I'm ready to sort of stop that now. I think that's, but I've made some nice friends.
That's good.